Hi everyone, my name is Annie Schneider. I have been with QHSC from the beginning. I am very excited to be presenting today on the role of nursing within clinical research. I hope you all enjoy my presentation, and please feel free to reach out to us via our website with any questions that you may have. All right, so I'm going to provide a high-level overview of different types of trials, review good clinical practice, and good clinical documentation. The information I am focusing on in this presentation focuses on specifics that apply to nurses. However, it is great information for everyone to know, not just nurses. So feel free to share this with your colleagues and anyone who you think that might find this information helpful. So I wanted to briefly mention the different types of trials. This is just a very simple overview. However, what I will present in this presentation applies to all types of trials. Within the clinical trial, there are different phases of trials. I'm not going to specifically go over those, but the resources I provide at the end of the presentation have additional information if you are interested about the different types of clinical trials. And there are two main types of trials: clinical, so that's where a patient is assigned a specific treatment, and then also observational, and this is just observing patients. So the main type of trial that I'm going to be referencing for this presentation is the clinical trial. All right, so I wanted to mention the International Council for Harmonization. So this was founded in 1990. The ICH mission is to achieve greater harmonization worldwide to ensure that safe, effective, and high-quality medicines are developed and registered and maintained in the most resource-efficient manner while meeting high standards. So while these are only guidelines, many countries have adopted these practices into laws. And as nurses, it is important to become familiar with the various guidelines, especially those that pertain to your area of clinical practice, in order to ensure you are practicing at the highest level. So some of the guidelines for clinical practice include quality guidelines, safety guidelines, efficacy guidelines, and multidisciplinary guidelines. So one example is a guideline for detecting toxicity to reproductive health in humans. These different guidelines are very important to be familiar with. One specific area that I wanted to focus on was the area of good clinical practice. And this includes good documentation practice, because this is exceptionally relevant to nursing practice. So we are all familiar with how important accurate documentation is and have heard the phrase, if you didn't document it, it didn't happen. This also applies to conducting and documenting for clinical trials. So the first thing that I wanted to discuss was source documentation, which is often referred to in clinical research as just source. So source is the very first recording of raw data. And some examples of this are the subject's vital signs and laboratory values. This can either be captured electronically or on paper. So you must be very mindful of where you are recording this data. If you have a habit of writing a blood pressure or temperature on your glove or on a sticky note or even a paper towel, guess what? That is the first recording of the raw data, and that needs to be filed within the patient's chart. So my advice is to get in the habit of capturing the first recording of data within the patient's actual research chart. And so there are certain guidelines that source documentation must follow. And these are known as the Alcoa Plus principles. So I'm going to be discussing in depth what each of these mean and why it is important to source documentation within the clinical trial. And we'll also be reviewing some examples of these at the end of the presentation. So the first attribute is that it must be attributable. And so this means that it's easy to tell who recorded the data point. And so this could mean that you initial and date near the data point, or if you're writing a nursing note, you sign your name at the bottom. This is easily captured with electronic records, but it's also very important for paper records as well. Legible means that what is written is easy for everyone to read, not just the person who wrote it. So we all know someone who might not have the best handwriting. I am guilty of this, but it's very important when recording data for clinical trials and just in general practice that anything we record is legible. Contemporaneous means that the data is recorded in real time. So we all know those nurses who write everything down and then chart at the very end of the shift. So this should not happen in research. Data should be recorded as it is happening. Or if you need to make a correction to what has been recorded, you record the date and the time that the date that the correction was made, and you initial that correction. And so I will show this in the examples at the end of the presentation as well. Original means that this is subject specific, and each document should be easily matched to the patient whose data it belongs to. So this means that the subject number is present on each page, and it's easy to determine which patient this chart belongs to, or this set of data belongs to. Accurate means that what is recorded is the truth and accurately represents what is actually happening during the subject's visit. So if you have a patient that comes in and has a high heart rate or a high temperature or something else that is happening that may be not what you expect, you are still documenting that, and that patient is being, and those issues are being addressed. Enduring means that it is long-lasting and durable. So everything should be recorded in pen, either blue or black ink, no fun colors, sorry. And if electronic documentation is being used, it should be backed up regularly. Also, any documentation that is stored after a trial is over should be kept in a safe location and easily accessible. Which leads us to our next point. Source documentation should be available and accessible for anyone that needs to review the data when requested. So this could mean that you're having a routine monitoring visit, or it could mean that you're being audited by a regulatory authority, which does happen. And so all source documentation needs to be readily available for review. Now, a lot of sites do store source documentation after a trial is over off-site, which is completely fine. However, the source documentation does need to be available when requested. Complete means that all data points that are required to be collected are completed, and if for some reason they aren't collected or completed, there is documentation of why this didn't happen. So I'll give an example of this later on in the presentation, but just to give it a little brief example right now, if a study procedure isn't completed, let's say a patient comes in for the visit and inadvertently a vital sign isn't collected or an area during the physical exam isn't collected, this needs to be documented why this didn't occur. And also, it's a good practice to have the timeline of events or the schedule of events handy during all patient visits to ensure that each data point that is needed for the trial is completed during that subject visit. Consistent means that data is collected in the same way from visit to visit. So ideally, we would use the same vital signs machine for each patient, for each visit, the same exam room, and this is for multiple reasons. One is so the patient is more comfortable in the research setting and gets to know and becomes familiar with what's going to happen during the trial, so it's not so scary for patients. Sometimes research can be a little scary or intimidating. And it also just means that we are collecting consistent data points throughout the trial. Credible means that the data is factual. If you forget to count the patient's respirations, don't just make up a number, document that it wasn't done and why. And finally, corroborated means that there is evidence to support what is being recorded. So to give a real life example of this, a subject uses the same vital signs machine each visit. The nurse records the vital signs as they are being completed during the visit in the patient's chart and then signs and dates next to the vital signs. So it is easy to see who took the measurements. And the nurse also records each number legibly. So this means corroborated just means that the patients are coming to the appointments and the data that's collected is easily supported by how the trial is being conducted at your site. So while this can seem a little overwhelming and seem like a lot to remember when you are documenting how a patient is doing for the trial, these are just really important guidelines to follow to ensure that the clinical trial is being conducted the same way between each site and to make sure that the integrity of the data is being preserved and that it's the highest quality of data that's available. All right, so now I want to discuss some examples of good clinical documentation. So if you make an error, make a single line through the error and initial and date the error. So I also want to mention that you need to include the whole year. So write 01 Jan 2021, not just 01 Jan 21. It's also really important to not obliterate or completely black out when an error is made. We still want to be able to read what is written underneath the error. This is just so we get a sense of what was documented and then the correction that was made. And I will discuss this further in another slide when I give an actual example. All right, and then we also want to ensure that any blank spaces that are left just have a single line marked through them, and then initial and date that single line. So we don't want to leave any blank pages or any big blank spaces. And so this just can indicate that maybe a specific procedure wasn't applicable on that visit or didn't apply to that patient. So that way we're not wondering, was this procedure not done or maybe just didn't apply to this patient. So just any blank spaces, just one single line through them, and then initial and date that line. So we can see in this example that the subject came in, the vital signs were taken. We see that the heart rate was a little bit low. And so then we can also see during this slide that a chart note was written. And so the patient presented for cycle 2, day 1. The study drug was administered per protocol. The patient denied any questions or concern. And the investigator noted that the patient's bradycardia and assessed that it was not clinically significant. The patient was counseled to take the study medication. And here I have an example of what not to do. So you don't want to just totally obliterate an error. It should be written as a single line through the error, and then the correction written beside it with the date and the person's initials who made the correction. And so then we can also see that the oxygen saturation was inadvertently not captured, and the nurse came in the next day and realized that mistake, and so drew a single line through that blank space with a date and the initials on that blank space. And also with the skin assessment, we see that that was inadvertently not completed. And so then with those assessments that are not completed, we also just want to document why that wasn't done. And so we can also see that this source has the patient identifier, the patient number, clearly on the top of the page, and then the date of the appointment. And so this is a good example. The only other correction that we would need from this is currently we don't know who wrote the chart note. And so we'd want documentation that a signature after that chart note. So it is attributable to whoever wrote it. All right, so you might be asking yourself, why does all of this matter? What is the point? I know when I started my career in research, I asked these same questions. It seemed like there was a specific way to do every little task, and honestly, it seemed like it took up a lot of time. So following all these little rules, especially for documentation, is extremely important. If everyone is doing something different or collecting data or documenting data in a different way, that data could be compromised. Having a set of guidelines that everyone follows improves the integrity of the data. And years after the clinical trial is completed, we can reconstruct the entire trial because data is captured and recorded in such a standard fashion. So I also just want to mention and these key points to consider is that you want to avoid your own personal bias when participating in the conduction of a trial. So this means that accurate documentation is key. Avoid thinking that the patient should be getting better because they are participating in the trial. This is not always the case. Some patients may not respond to treatment as we hope, or they may be getting the placebo if it's a double-blinded trial. So your job as a nurse is to provide the most accurate data in the trial while caring for that patient and making sure their needs are met. And this could also mean that they need to withdraw from the study or the trial because they are not getting better. And so we all want to help these patients, but we need to accurately document exactly what is happening. And so a good way to think about this is you don't want a potentially ineffective drug to go to market. So if the drug is not working, that's okay. We need to determine that during the trial. And that is the point of clinical trials. If the drug works, that is amazing. But if it doesn't work, that is fine as well. It's also really important to know your institution's policies and procedures for conducting research and have those policies and procedures on hand to reference whenever you need them. Auditors from regulatory authorities can arrive at any time at a moment's notice, so it is crucial to have these policies available that are supporting how you are conducting the trial at your site. It's also really important to know the protocol. You have to know what specific procedure is being done that day during that specific visit. So knowing the protocol is crucial. And as I mentioned before, having the schedule of events handy and ready during each patient visit is a really great practice to have and get in the habit of. And also, as I mentioned before, document, document, document. If you didn't document, it didn't happen. And so this means that you document if something inadvertently got missed or if the patient is having an abnormal reaction. We need to know all of this and capture all of this. So I cannot stress, and that was why this is what the presentation was focused on, was documentation. So I hope that you learned a lot during this presentation. I have my references coming up on the next slide, so feel free to take a look at those, become familiar with those, and as always, if you have any questions at all, please reach out to us on our website. We would really love to hear from you. Thank you so much. I hope you learned a lot. And please let us know if you have any questions. Thank you.